I'm just really excited to have them and have Nanette here today. And so I'm just going to hand it off to you, Nanette, and let you get going with it.
Well, thank you. Good morning, all. Happy Friday. Although I don't know about you, but in this COVID, all the days run together, so I rarely know what day it is. So I'm not sure that Friday has as much significance as it used to. I was sharing with the group before everyone got on that we've been hearing a lot about COVID fatigue and Zoom fatigue. So thank you for joining another Zoom meeting. But I want to say that I was having a lot of travel fatigue and a lot of conference fatigue before COVID happened. So I might be living a little bit of my best life, slowing down and getting to see everyone all across the country all the time. I mean, we used to have to go travel in planes and sit in hotels and stay long times to be able to see people who are across the country and doing the work we're doing. And it is quite a blessing that we're able to do this over Zoom and see each other and all join on calls. So as much as we're having Zoom fatigue, I am hoping that some of this will carry on through our work after the COVID time. So thank you for joining on another Zoom call this morning. I really like to speak and dialogue. So if you guys have questions, I know that we've asked that everyone be muted, but if you have questions through the course of this, please don't hesitate to put it in chat or to raise your hand. And I'm gonna ask Brandy, are you there? You're there. I'm gonna ask Brandy if you'll kind of watch the chat, and if I'm missing a question or something you think I should address, if you would bring that to my attention, I'd greatly appreciate it. Otherwise, my eyes, I go like this to the chat and then it looks weird. So I'd appreciate, Brandy, if you just bring that to my attention. So Brent asked that I speak to you about transition and aftercare services. And so to do that, I'm gonna have to age myself a little bit. I started in this industry back in the 80s. And when I started working in addiction and mental health, there wasn't a lot of aftercare or transition services. I worked inpatient psychiatric, there was inpatient psychiatric, there was aftercare, was either an IOP, an intensive outpatient program, or a partial hospitalization program. There were very few sober livings. And that was about all of the services. They were starting, the private pay world was just starting in that time, and they were residential settings, but there was no transitional length of stay. It was the Minnesota model, you know, the 28 days and the client went home. And a lot of people's business plan was based on recidivism, based on the client returning. You know, the client going home, not doing well, not succeeding, and returning to treatment. And that was the business plan. And when that happened, that was the blame of the client. You know, what I heard a lot in the 80s was, we give the client everything they need. And when they leave us, if they fail, you know, it's because they weren't willing, right? So in the 80s, there was a lot of information and a lot of emphasis put on willingness. And I think what we know today is there's a big difference between willing and able for our clients, and what they're struggling with as they're transitioning out of a residential acute setting. You know, what we know today is addiction, mental health, or chronic diseases, and that hospital settings and short-term residential are acute solutions for long-term chronic illnesses. So an acute solution for a chronic illness is never going to be enough, is never going to give a client what they need to be successful and what they need to carry on recovery, even if we're the best treatment center, even if we're the best hospital and provide the best care. There's a difference between knowing the information and being able to apply the information in daily living. So back in the 80s, I was working for a place called C2 Education in the Brown Schools. I had left College Hospital. I was working in the private pay world with adolescents and young adults, and we were long-term long-term treatment, wilderness programs and long-term treatment. But even then for long-term treatment, when the client was ready to go home, when the child and family were ready to go home, we kind of walked them to the door and said, follow the yellow brick road, bye-bye, you know, here's your piece of paper, here's your instructions, now go home and make it happen. And what we know is that that wasn't successful. You know, people weren't able to take what they learned and apply it into their daily living without continued ongoing direction and support. So in 2002, I was approached by a woman by the name of Deborah McGaldy, and she was a client who, not a client of mine, but a client of multiple treatment centers. She'd been to treatment actually 7 times, and was a great client, knew what to do in treatment, could probably run some groups herself, was a very successful businesswoman, but she couldn't take the information home with her. She couldn't apply it into her daily living, and she couldn't maintain sobriety. So she actually hired her therapist from a treatment center to go home and live with her. That was her solution, you know, to how to transition home, how to be successful outside of the doors of residential treatment. And she put some time together, 4 months. Her therapist lived with her and helped her do life on life's terms, and helped her in those teachable moments to apply the information she learned in treatment and to build and continue her sobriety. And she came to me and said, you know, I have this great idea. And this great idea was the beginning of Hired Power and our transition services. And so it was back in 2002, early times. And again, at that time, there was a lot of hospital-based treatment. There was a lot of residential, you know, short 28-day Minnesota model treatment, but there was not a lot of extended care. And we use a lot of different terms, right? Extended care, transitional care, aftercare, but there wasn't a lot in that space. There was aftercare services at the hospitals, an IOP or PHP, and then there was sober living. So we got together and started talking about this idea that she had with hiring the therapist to come home with her. And we talked about, a lot of that was happening in Hollywood with the high profiles. You know, there was sitters and minders and other types of services that would transition with the high profile or with the wealthy. But there was no one that was transitioning with the rest of us and the rest of our clients that were going home. So we put together what we call our personal recovery assistance services. And I'm not sure how many of you are familiar with personal recovery assistance services. Many of you know that to be sober companions or sober coaches, right? Pretty familiar with that. So we started to professionalize that service. And what I meant by professionalizing is early on, it was a lot of what's done with sponsorship, right? It was more peer-to-peer. It was what the professional brought to the service was their own recovery experience. And that was really all they brought to the experience. There was no training, there was no education, there was no model of service. It was kind of go home with these people, move in, and help them stay sober any way you can with whatever tools you have in your tool bag. And most often, back in 2002, that was only their own 12-step program, their own series of recovery, their own methodology of recovery. And what we've done with Hired Power is we've really grown that level of professionalism. Our goal throughout this time has been to create a model and to create a system of helping people in these teachable moments to take what they've learned in treatment and help them apply it into daily living skills in those teachable moments in their home, whether it's on the road, working, or in their home environment, whether they're living with their family or living separate with their family until they can get back with their family. And we've created a system with training and education and experience. So really creating a professional service, not a peer-based service. We all know that there's currently a big push with peer recovery, and peer recovery is great and very necessary, and a lot of community-based organizations are supporting peer recovery. But what we're talking about when we're talking about personal recovery assistance is we're talking about another professional, another level of education, awareness, and training to be in the home and to be part of the treatment team. And that's a really key part, and a really key thing to talk about is when we are working as personal recovery assistants, that we are part of a team, that this isn't a one-man band, one person working with a client, but this is a professional, part of a professional team with a therapist or a psychiatrist when medications are on board, with a case manager, with a community of resources, and connecting these clients to a community of resources so that when we leave, we're not taking all of their resources with them. We are coming in, helping them apply their tools and their skills into their daily living process, connecting them to their community resources, to their community professionals, helping them build a team of resources. And then we're exiting out, leaving them with a full, robust team of recovery and support and a daily living plan. And so that was really the start of Hired Power, was building personal recovery assistance and creating the service from 2002 to 2020, and how that has grown. We're pretty excited about that. I know many of you on this call have attended, and hopefully more have attended, the International Recovery Institute, which is the credentialing program that I wrote along with Dr. Judith Landau. It's the first credentialing program for personal recovery assistance for sober coaches or sober companions across the country to create a level of professionalism. So we've really raised the bar and continue to raise the bar on those professional services and support services around clients as they transition. And looking at, how we support them taking what they've learned home. And so recidivism, returning to treatment, and gaining more skills just by returning to treatment isn't the only option. Does anybody have any questions or comments that they want to add around sober coaching, sober companioning, or the transition services of that? I know a lot of you on this call are very familiar with it.
Can you talk just a little bit, Nanette, about what, like, I know you talked about professionalizing it, but maybe what we, what's the word I'm looking for? Sorry. What our criteria is for a sober companion, 5+ years, just so.
Sure.
Like the staff that we, choose and why we choose them, kind of.
Sure. So again, in an effort to create professional standards, what creates a professional? What are the standards that qualify for a professional? We came up with it based on two things. One, the studies indicate, right, 5 years of continuous ongoing sobriety. The studies, the long-term success numbers increase exponentially, right? When we can get to 12 months of continuous ongoing recovery, 24, and the studies indicate when we get to 5 years, there's long-term potential for success. So we based our continuum on that 5 years. And then as most businesses do, our liability insurance also wanted 5 years based on the study. They thought, okay, if the studies are indicating 5 years of continuous ongoing sobriety, then that's probably what we should consider too, from an liability insurance profile. So we require 5 years of continuous ongoing sobriety. Does anybody have any idea why I would use the words continuous ongoing sobriety? Any idea of some experiences I might have had that continuous ongoing may not have fit into the early curriculum? So I'll tell you a quick story. I interviewed a man, great guy in the office, came in, presented 7 years of recovery, you know, how do we document sobriety, right? How do we document recovery? And we ran a background check like we do, and we ran a DMV report. And lo and behold, this DMV report, I called him and I said, I want to tell you, you must have identity theft. And he said, what? Why do you think that? And I said, well, you must have identity theft because you have 7 years of ongoing sobriety and a 2-year-old DUI. And he said, oh, darn, I didn't think you'd check. You know, because how do you document sobriety? So the way we're able to do that is we do look at background checks. We do look at DMV reports. We want to know that the staff that we are placing in the home with our clients, you know, are solid citizens currently today and are living lives of recovery. So if they have 7 speeding tickets in the last year, they're probably not going to be a great mentor for someone else. You know, maybe their judgment or ideas aren't really in line with the tasks that we're looking at with our clients. So we require 5 years ongoing continuous sobriety. We do personal and professional background checks, DMV reports. We do require credentialing. So as of 2017, we've been asking people to either have a state certification, so a drug and alcohol certification within the state where they live, and or a certification in the recovery service. So either with IRI, the International Recovery Institute, or CCAR is another certification body that we recognize. They do the peer recovery training. They've done it very well for a number of years across the country. So we do ask that all of our staff have a certification, again, increasing that level of professionalism from just a peer recovery, from just bringing just our own stories of recovery and just our own experience in our own programs of recovery, and really raising that bar to a level of professionalism, training, and education to bring to our clients. Any other questions about recovery specialists or peer recovery?
Yeah, I've got a question. So, like, do you guys have like a set time frame, you know, that you require to work with someone? Like, how is all that decided?
In working on an assignment with a client?
Like with a client, right?
Sure. So as I said, it's really important that we are working with a clinical team, that we're communicating and establishing that team. So all of our cases are clinically driven. So along with the client is part of that as well. They come in with their own ideas. You know, I want someone for a week, or I want someone for 2 weeks, or my therapist asked that I have someone for 30 days. And so we may start with a time frame that the client is comfortable with or has an idea about. But during the course of that, we're working with their clinical team and our case management team in the office, and we're looking at what's necessary. You know, clients oftentimes tell us what they want, but they show us what they need, right? Does anyone else experience that with their clients? They tell us what they want, but they show us what they need. And so it is our job through the course of our work to help them see what they need, which doesn't always align with what they want initially, and making sure that we're there for an appropriate length of time to transition them to the next step. Okay, all right, good. So one of the other services that we offer are interventions. We've been doing interventions since 2002. And I don't know about you guys, but I've done my first sets of Zoom interventions. Anybody else on this call do interventions? Jay, yeah, I know you do. Yeah. So what a wacky world, right? We're living in the intervention, because, you know, clients are still needing interventions. Clients are definitely facing heavier, life-threatening situations than just COVID right now. And we have to be COVID conscious and follow COVID rules. But a lot of our clients, you know, depression is increasing, relapse is increasing, drug use and alcoholism are increasing. So our clients are still needing us in the intervention space. And and trying to be there to meet their needs while still recognizing our limitations around travel and group settings has been a challenge, but it's a challenge we've accepted. So we are continuing to provide interventions through COVID, and they're abridged over Zoom, partially over Zoom, maybe a couple of us in a room and half the people in on Zoom because, you know, people aren't traveling and flying. But we do interventions across the country and internationally. We work with substance abuse, mental health, and eating disorders. So covering a pretty broad spectrum, and again, working very collaboratively with treatment centers and community-based professionals to provide those interventions and to safely get clients to the door of treatment. So we're adapting and we're adjusting to the time of COVID, and how do we continue to serve these clients and families that are in desperate need of support in getting their loved ones to treatment, but are also very fear-based about what's happening in the world with COVID, and how do they get their loved ones to treatment, and how do they hold boundaries and have conversations during this time. We've gotten a number of calls. I got a call. I think families are really starting to face some of the addiction and mental health that maybe they didn't recognize or see before the COVID situation. I got a call from a husband who was working 14, 16-hour days as a standard before COVID, and then started working from home during the COVID situation. And he called me pretty desperate with information saying, I think my wife is an alcoholic. I think my wife needs treatment. And he said, I would come home at night after a 14, 16-hour day, and she always would have a glass of wine or have alcohol in her breath. And he said, but it was 8 o'clock at night or 9 o'clock at night and the children were in bed. So I never questioned that. And now that he was working from home at COVID, he realized that her drinking began at 8 a.m. and went throughout the day with his children, home, driving his children, and doing other things. So I think that families are learning a lot more information during this COVID time when we're all sequestered, you know, together and not out for work. Any questions or comments about intervention? No? Okay. So one of the other transition services is safe passage. So I know all of you, I'm going to say what I always say, and you've all heard it before, but we coined the term safe passage because transport reminds me of cattle. You know, we're not shipping cattle across state lines, you know, and escort is something else we don't do. So we coined the term safe passage, and that is really creating a safe place to get clients from home or where they are, whether it's in a hospital or a primary residential setting, to their next level of care or to their initial level of care. And safe passage has been another service that we have continued to provide through COVID. We've been, you know, driving or flying depending excuse me, depending on the clients and the treatment center's desires. Early on in COVID, a lot of treatment centers wouldn't accept clients that were flying in. We went to pick up a client from Texas, the wonderful state of Texas, where you guys are all at Dougtree, and the plane was met by the marshals. And yeah, it was when they were requiring that 2-week quarantine. Remember the period of time in Texas where they wanted the 2-week quarantine? So the marshals actually met our plane. Our staff had to show them that they had an address where they were going. We were picking someone up, and that we had an afternoon flight back out of Texas. But they actually didn't let a lot of people off that plane who didn't have quarantine plans, who didn't have a place to stay for 2 weeks and couldn't prove that. So there were treatment centers that didn't want people to fly. There were families that weren't comfortable with people flying. So we've been driving and flying and figuring out ways to get people safely from one place to another to the doors of treatment all over the country. And it's been different, but it's been doable. And we've been, again, happy to provide those services to families and clients that really need to get to the door of treatment, but have had some difficulty through the travel restrictions. But it's been an adventure. Any questions about safe passage?
I have kind of a general question just across the board with all of them. Do you have folks in all the different states, or do your people come from California to meet clients for peer recovery or intervention or safe passage for all those things? Or how does that work for?
So we do have staff in many states. I can't say all the states. There's a lot of states. But we do have staff across many states and internationally that we have put through our vetting process, you know, the background checks, all of that, and are certified and qualified. So yeah, they're all over. We're pretty blessed that way. But we really match people to people. So obviously sometimes we're looking at geographics when a personal recovery assistant maybe wants someone hourly, a few days a week, couple hours a day versus the live-in situation, then we're definitely looking for resources more locally that can work with them on a continuous ongoing basis a few times a week or hourly. But we also do a lot of matching to make sure that the staff that we're sending, you know, have common interests or experiences or education that are going to fit the profile, especially when we're talking about mental illness or eating disorders.
Great, thanks.
Thanks for the question, Katie.
Sure. I'll ask one more question since I was asking questions. Price points, since there's price points are kind of all over the place when it comes to interventions and sober transports. Can you talk a little bit about price points?
Sure. So again, I can speak to Hired Power's price points. For intervention, and this we'll get onto that subject a little more, but all of our interventions are comprehensive, meaning that we aren't just doing intervention. We work with our families for a period of 13 to 15 months. And that sounds long, but we include a year of monitoring services. And we'll talk a little bit about monitoring, but in our intervention services, we do all of the pre-intervention coaching and family work, obviously, identifying the appropriate level of care and where they're going, working with the family in the pre-intervention work. The intervention itself, we do provide that safe passage component as part of our intervention, and then a year of monitoring. So all of that is $10,000 plus expenses. So it's pretty cost effective when you look at the 13 to 15 months of case management and monitoring that comes with interventions. And we do that intentionally because, again, trying to get our clients to that year of recovery, to that 12 months of continuous ongoing sobriety and recovery and daily living plans where we know long-term outcomes improve. So we put a lot of thought into why we provide those services all together. And so we're not the company that's just going to come in and provide the intervention and disappear. Now, saying that, we do work with a lot of educational consultants and community professionals that are providing some of those wraparound services. So we may come in as the team, as part of the team that does the intervention piece, but then we stay collaboratively with the educational consultant or with the home therapist that's continuing with the family, and we continue to provide those services and support.
And Nanette, it's Rosemary. Hi.
Hey, how are you? Long time.
Great. So as a consultant that does place treatment, we appreciate the fact that you stay involved for that time. You know, many of my colleagues don't do a contractual agreement, but my agreement is also for a year. So anytime I can be part of anybody's team to stay involved with that family at the treatment program level, with your level of intervention, is just lovely. As many people as we can have on the team. And I just want to, first of all, thank you, obviously, for your many years of being in the business, as I have as well. But what I appreciate more than anything is you bringing the professionalism to the side of the recovery side, because many of us remember when there was no professionalism whatsoever. You know, like you said, if you were in recovery, you could help, and many times that was helpful, but it wasn't professional. So I want to thank you for that. So when you were talking about hiring your staff, and of course the reason I jumped on today is obviously because I have a client that needs a next step, probably not going to be interested in doing a program as a next step, wanting to go be with parents internationally. So I'm sitting here thinking, okay, train wreck coming. You know, what can I throw at this family to tell them we have to have supports in place? And so obviously looking at hired power and wanting to listen in on information today. So, you know, they've done a couple of other things that they felt uncomfortable because the family is not totally wrapped around their child having the disease of addiction. So they see people at programs smoking, you know, or having these smoking porches, and they see that's just kind of as evil. So I guess my point is they're not loving the fact that where they had been prior to calling me, and they're in a program now where this is not the case, but where everybody was in recovery, like that's kind of the criteria for helping. So my question would be, as you're putting professional staff in place, you wouldn't, I mean, you hire some people that are also not in recovery. It's not a requirement, or is it a requirement that you be in recovery?
It's not a requirement. I mean, obviously this field, you know, the majority of people who find interest and come to work in this field come from their own stories and their own experience. So the large majority of people are recovery-based professionals, but we do have people who also come because of their family stories, because of their own personal interest in education, because of their own passion for helping others. And it is not a requirement, and we do have staff that that their recovery journey may not include substances as past.
Right. Yeah, that's what I was thinking, and I just wanted to make absolutely certain, because I certainly appreciate what you guys have done. It kind of reminds me of when we created NATSAP. You know, we had to put things in place for those adolescent programs that were not recovery programs. They were just therapeutic back in the CDU Brown School days. So just putting those things in place. So grateful for what you've done. Love listening in. It just gives me kind of that updated information as I go talk to my client family.
Yeah, and that's the best work of what we do. I mean, my team's on this call, right? So Deidre and Brandy and Alex and Marnie. And I think the best part of our job is kind of being puzzle makers. You know, we get cases presented to us like, okay, I've got this one. You haven't heard this one before, you know, and I think I've been doing this, you know, I've been working in addiction and mental health. Gosh, I'm going to age myself, but I was thinking, you know, mid 80s. I'm 30 years, you know, over 30 years working in this industry. And we think we've seen it all, right, until the next case comes. So we do meet the clients where they're at and where the family's at, and then we grow from there, right? Because if we can't join them early on where they're at, we can't introduce them to more and open their awareness and help create that willingness. So we are very much puzzle makers and brainstorm with providers to figure out how we can best meet the client where they're at and build from there.
I love puzzle maker. I was telling a client yesterday when she was thanking me for something, I said, I'm simply the traffic cop, but I like puzzle makers better than traffic cop. I just direct you where to go, you know?
Yeah, as puzzle makers, we bring in all the pieces, right?
There to go. I like that better. I like that better.
Bring in all the pieces for a complete picture.
Yeah. Well, thanks for having me. Thanks for doing this today.
Well, it's so great to see you, Rosemary. I was talking to Katie. It's been a while since I'd seen her, but it's been a long while since I've seen your pretty face.
Yes, I'm still around, but thanks.
Thanks for joining us today. So that leads into Katie's question about our intervention service. Leads us to our monitoring service. So monitoring is an accountability partnership that we provide clients with as a transition step. And we do provide it as part of our intervention services, but we also offer it to any client that is in transition from any level of care. So most often, the monitoring service, which is a 12-month, again, based on long-term studies, right? 12 months of continuing ongoing sobriety. Monitoring is a 12-month program. It was created for those professionals that needed to be able to substantiate sobriety. So doctors, dentists, lawyers, people whose license required documented evidence-based sobriety. That was the beginning of monitoring. But again, Hired Power saw that service as a service that could be expanded into the community, into any of us that were leaving treatment, any families that needed that ongoing accountability partnership as they transitioned from treatment. So we work with a lot of treatment centers across the country, a lot of therapists and psychiatrists who bring in monitoring as an accountability partnership for their clients. And what monitoring looks like is clients check in on a daily basis on a software system, their cell phone or their laptop. It's a quick check-in. They are randomly selected to drug screen. And where initially all of our drug screens had to be at labs, you know, we contract with a lot of third-party labs all across the country. A service that we started in January that I'll talk more about, the Coach Connect brought with us the ability to do in-home DNA testing. So through this COVID time, we have been able to do some in-home DNA testing. Our clients no longer have to go out to a lab for monitoring or for our other services where they do drug testing. Those tests can actually be shipped into their home. They do an initial DNA cheek swab, and then all of their tests are checked through the DNA matching. And it's been a pretty amazing process to see, again, how our clients are so smart and so willing to go the extra mile in modifying those tests rather than just submitting a clean test. But our monitoring includes the ability to test at labs, the ability for in-home DNA testing, and we do use a breathalyzer device. So we can do the on-point alcohol breathalyzer 3 to 5 times a day, up to 10 times a day. We haven't had yet a client that's needed 10 times a day, but we do the testing along with the daily check-in and then the weekly check-in with their monitoring case manager. And that case manager communicates with the family or identified loved ones should the person stop checking in or not test or test positive. Then we're pulling that puzzle together, circling those wagons, bringing in the resources to, again, surround the client to what do they need, what level of support do they need in monitoring. Sometimes it's just a quick, stumble, and sometimes it's more, and they need us to really rally the support. But our monitoring program is 12 months. And Katie, to stick with your request, it's $3,800 for monitoring for a year of service. So we're really proud of that price point because we believe that whether clients are insurance dependent or they have the financial resources, $3,800 for a year of service is something that most families and clients can really wrap their head around, even if they're insurance dependent or not, financially higher profile. The testing is separate, whether it's lab fees or the in-home DNA or the breathalyzer test, but the monitoring service itself is $3,800. And Laura Crossett, who's not on our call today, is our monitoring case manager and works with all of our clients and families. With our monitoring service, we also do a lot of family coaching. So the families can add on additional family support and services to their monitoring case management wise, have extra coaching and access to helping them create that accountability partnership, helping them live to those healthy interactions, healthy communications, and helping the family really stay in their lane. stay out of the policing role, stay out of, you know, really those fear-based interactions that a lot of our families have in early recovery because, you know, they're afraid and their past experiences hasn't been good. So having an accountability partner that they can count on, that they can call to say, here's my concern. You know, Johnny didn't come home last night, or Johnny's eyes looked pinned, or I thought I smelled alcohol, or, you know, we can take those families out of the policing role with monitoring and come from a therapeutic standpoint and surround the family with services that they need. Again, identifying what those levels of care are. And we provide monitoring services for any client. They don't have to be a hired power, intervention or service to access our monitoring services. Any question about monitoring? Is monitoring new to anybody? Is anybody not familiar with monitoring?
It's not new, but I think it's a very underserved population, and that's very reasonable pricing. So that's,
Yeah.
we'll have to get connected with the person who you said is not on this call that has all that information, because I think that's something, I mean, I'm thinking just off the top of the head, but some individuals that could really use that.
Right. When I think about monitoring, I don't think about who needs monitoring. I think who wouldn't need monitoring. You know, right? We've invested all this time and resources into getting our loved ones into treatment, into a residential stay or a hospital stay, or into this, and then what? You know, again, we know there's a difference between willing and able. What we want to do and what we're always able to do aren't the same. So if we can provide an accountability partnership for the client and for the family and help the family get through their fear and exercise their new tools and stay out of policing and into healthy communication and their own healthy recovery, just imagine the outcomes that could happen and what our percentage of outcomes could look like if we could really get all of our clients to 12 months of ongoing continuous sobriety. So it is a service that I don't think of who needs, I think of who wouldn't need, you know, and how do we align our clients with that as a transition step. So yeah,
Thank you very much for that.
I have a little heart space for monitoring. Can you tell? So that's our monitoring service, and that leads me into case management, because with our monitoring service, sometimes we're doing case management. So how many of you are familiar with case management services? Yeah. And how many of you know that the term case management is about as broad as transition care or extended care or aftercare, right? What case management means to one person isn't what it means to somewhere else. It's a term that we use very frequently in our industry that could mean a lot of different things. So I'll only speak obviously to what case management means with hired power, but it is really where that puzzle making piece comes in. We work almost all of our cases have a case management component. All of our PRA, all of our companion services have a case manager in our office on our staff, working side by side with our personal recovery assistant staff, with the families and with the clients. So we're really providing a comprehensive wraparound service, whether it's our monitoring, our interventions, our safe passage, or our personal recovery assistance. They have a second professional who is supporting those services and overlooking all the puzzle piece. So we provide case management services as a standalone service as well, meaning that families can utilize us to be that transition coordinator and really make sure that the treatment plan that has been, the aftercare plan that's been designed while they were in treatment actually gets implemented in their aftercare program. So we coordinate with IOP, PHP programs, individual doctors, therapists, family members, sometimes trust attorneys, probation officers, parole officers, whoever is part of this ongoing recovery plan. We kind of hold all those pieces together, create a safe container and a communication space to make sure that things aren't falling through the cracks. So making sure if, you know, a lot of discharge plans say, find an individual therapist, find a family therapist, go to 90 meetings in 90 days, get a sponsor. But putting those into actualization, if we have a personal recovery assistant on the ground, then that's obviously a lot easier to make sure that those aftercare plans are implemented in a daily plan. But a case manager can also communicate with the family and the professionals and make sure that the communication is seamless. You know, if a lot of times we'll get a case, and I don't know how many of you see your clients coming in with 3 or 4 different doctors or 3 or 4 different prescribing professionals, right? A lot of people have many more people on their team than they should entering into recovery. So we want to make sure too that they're not staying connected to those overprescribing or long-term prescribing or, you know, multiple prescriber situations, and that we're really making sure that the team is effective and cohesive. So case management, again, we work with clients that go through our system, but also clients that are referred to us directly on a discharge for a case management plan around their recovery and their recovery goals. And I know we only have a few minutes because I told you, Brent, I could talk forever about this, and I knew he was going to have to shut me off. But I want to talk really quickly before we run out of time about the Coach Connect. And the Coach Connect is really a brainchild of Brandy and something that we've brought to Hired Power and started right before COVID. So we launched the Coach Connect in January. No idea COVID was coming, but it is our virtual platform, our virtual coaching platform that is an app-based platform that are offered to clients as a transition plan. Again, another great price point service. It's $1,300 for the initial assessment intake, and then it's only $1,100 a month. And they meet with their coach multiple times a week. They have access through the app to email, FaceTime, and texting with their coach. Testing can be, the testing results and information can be accessed in the app, and also GPS. So we can, if someone says, I'm at a meeting, we can actually look and verify that they're at the meeting, or I'm not at my boyfriend's house that I'm not supposed to be at, or at my drug dealer's house. We can actually look through the GPS system to see that they're not where they're not supposed to be, and they are where they are supposed to be. They have access to their coach, and it is a great support system virtually when you can't either financially or geographically have a face-to-face coach. This service is really working well with clients that are returning to college, clients that are in areas that are difficult to reach geographically, but actually for anyone that's transitioning home and wants that added long-term connection and support, but doesn't have the financial ability for, you know, a one-on-one live-in, or needs more than just you know, their check-ins with their therapist or their psychiatrist on their weekly basis. So we're really excited about Coach Connect. Like I said, it launched in January, not knowing that COVID was coming, but has worked perfectly for a lot of our clients who needed that care during the COVID time, where we haven't been able to be with them one-on-one.
Nanette, Katie is asking, who are the coaches?
So right now, Brandy, our case managers within Hired Power are still our coaching staff as we, you know, work through the initial process. So Brandy is our lead Coach Connect coach, and working with our clients and families. And then as we grow and expand, we'll be utilizing our certified recovery specialists, personal recovery assistants as coaches. Yeah. So again, keeping that professional standard of service. So any questions? Because I feel like I've rattled on, and I know we're at 10:55, so I don't know where we are time-wise, Brent.
12:55. But that's some of the best rattling I've ever heard. So, you know,
Thank you. I appreciate that.
oh, that was wonderful.
I love what we do. Obviously, you know, we've worked at it a long time. I have a great team. I've worked with, I think, everybody. Hey, Ruth Ann, I've worked with everybody, I think, on this call. Very blessed to have that ability to work with professionals all across the country. So we love what we do. We love the teams and treatment centers and therapists that we work with. And we feel pretty blessed to do the work that we do on a daily basis.
Does anybody have any more questions? Anything for Nanette? Well, I want to thank you because that was, I'll tell you guys this. I went to California, met you guys, and I came back, you know, talking to Kurt and everybody like y'all were undiscovered. I was so excited. I just was like, you know, Kurt was laughing. He's like, yes, they're wonderful. I know. But yeah.
A long time. We adore him.
Yes, he's awesome. And I just really love what you guys do too. And you know, the pricing, when you guys first told me, I did the same thing Katie did. I was like, wait a minute, she's missing a few months there or something. Like, that's just, for what you guys offer, it's amazing. And just, you know, goes further to the fact of that you're doing what you want to do because you want to help people.
Yeah. We want to be of service. We want to collaborate with you all. We want to work with the clients that you're working and support those families. And again, you know, really, we work best collaboratively. We are just a piece of the puzzle, you know, and so we're just as happy to be the puzzle maker as we are to be a piece of the puzzle for your clients and families. So however we can be of service, if it's just bringing in one of our services under your scope and under your care, we are happy to provide that. We just want to be available to provide the clients with what they need.
That's awesome. Well, I want to thank you again, and everybody else, if you haven't put your information in the chat, you know, and I thank everybody for coming. And yeah, of course I'm biased, but this has been my favorite one. So
I appreciate you. I appreciate all of you today.
yeah, look forward to seeing you guys.